Hi, thanks for watching my channel today. I'm glad you're able to join me today. I'm going to deal with 10 conditions that will raise a red flag. So I hope you stay tuned and watch to the end. And also, if you haven't subscribed, please do subscribe. And also, I have already shown you a video of 10 conditions that will raise a red flag. So this is part 2. So if you haven't seen part 1, I advise you to subscribe and also go and watch part 1, because that will give you a complete picture of 10 conditions that will raise a red flag. Let's get into it. So number 1 is persistent heartburn or acid reflux. Heartburn and acid reflux is common. If you've had a heavy meal or you've rushed your meal or you have a very spicy meal, it's okay to have heartburn. But if you're having heartburn that you cannot explain, it's not like you had a heavy meal or you had something, spicy or anything, you've done something different, then that could be a sign of what we call acid reflux. But this is more serious than just acid reflux. It's called gastric esophageal reflux disease. So you need to be careful. You need to see your GP, because this heartburn can be serious. It can also give you what we call esophageal cancer. So any heartburn that is persistent, that has lasted for a week, my advice is to see your GP. Number 2 is change in the moles or lesion on your skin. Now, a lot of us have moles either on our body. Some are flat, some are the same, some are different colors. What matters here is the size of the mole, the shape, and the color. Has it always remained the same? Any change in color or size or shape of a mole signifies a problem, because that change can mean that something sinister is happening. It could be a sign of skin cancer or melanoma. Talking of skin cancer and melanoma, I don't know whether you have seen my video on why people still get sunburned. Some people apply sun lotion and they get sunburned. Why am I talking about it at this point? It's because some of the skin cancer, to be honest, is caused by either going on a sunbed excessively or staying in the sun without putting enough sun lotion. So if you haven't watched my video on 7 reasons why you get sunburn, please go and do that. Subscribe, because if you subscribe, then you can see my video and you can watch the one that is important to you as they drop. Anyway, I will carry on with the 10 conditions. Number 3 is persistent cold sore. Cold sore is something that comes on when we are stressed. Sometimes it's due to change in temperature, maybe when you go from summer to winter. Or some medication can give you cold sore. But I'm talking of cold sore that have lasted for 3 to 4 weeks. No explanation. It has nothing to do with medication. It has nothing to do with anything. If it's lasted that long, seek your medical advice from your doctor or your GP, because cold sore that is persistent, that has lasted that long, could be a sign of oral cancer or some form of autoimmune disease. Number 4 is abnormal vaginal discharge. Now, again, vaginal discharge is common in women. Women get a tiny bit of discharge, which is normal, sometimes odorless. But what I'm talking of is an abnormal discharge that a color is abnormal. It could be cheesy, it could be milky, or the smell is disgusting. It could be fishy smell or whatever kind of smell. Especially when you have a vaginal discharge that is greenish in color, that's not good. Yeah, that's a warning sign. So my advice is see your GP. Most discolored vaginal discharge, it could be a sign of sexually transmitted infection. It could be a sign of what we call bacterial vaginosis, which you can treat easily. It could also be a sign of thrush, which can also be treated easily. But the problem with these is that it's a question of knowing that these are not normal and doing something as early as possible. Number 5 is flashes and floaters. Sometimes people say there's something going on in their eyes. It looks like their eyes is, when they face the light, it's flashing and it's floating. It's a warning sign. It could be a retinal detachment or a retinal problem. See your eye specialist so that they check out what is going on in your eye, because it could be a sign of retinal detachment. Number 6 is bloating. Now, when we have too much to eat or too much to drink, we can get bloated when we go to parties and we drink and we make merry, and you can drink and wake up the next morning being bloated. That is not normal. Yeah, eating and drinking and enjoying life, you can wake up next day bloated. But I'm talking about when you feel bloated, when nothing has changed. So frequent bloating, or when you feel that even to eat is difficulty in eating, feeling full when you haven't even eaten enough, that is also a warning sign, because that could be a sign of ovarian cancer. So if you're feeling bloated, you don't even have appetite to eat, or that you feel full when you have eaten a little bit, that could be a sign of ovarian cancer. Consult your GP to check that out. Number 7 is chest pain. Chest pain could be a sign of heart disease. So if you're having chest pain with tightness, or you're feeling breathless, or you're feeling that you're panicky, that could be a sign of heart condition. Please see your doctor. The thing is that people walk around, heart condition is one of those conditions people walk around not knowing they have heart condition, because high blood pressure can result to heart condition. So if you need to check your blood pressure, walk into any pharmacy, walk into any doctor's surgery, keep an eye on your blood pressure. I will advise check your blood pressure every 2 years at least, and just to make sure your blood pressure is okay. Number 8 is on unexplained weight loss. I'm not talking about when you are making an effort to lose weight. You know why you're losing weight, or you have cut down on your diet or cut down on your carb. That is normal. I'm talking about the weight loss that you're having without even any effort. So if you're losing weight without even cutting down your food or changing any lifestyle, that's not good. Weight loss that is you cannot explain, it could be a sign of metabolic disorder, could be a sign of significant stress, maybe under stress. It could be a sign of cancer. So always find out what is causing you to lose weight. The earlier you deal with them, the better. Number 9 is swollen legs. Now, swollen legs is what we get when we have been on our feet all day, especially when the weather is so warm. It's all right. Diet can also give you swollen leg. Some medication, some blood pressure medication, for example, can cause you to have swollen legs. I'm not talking about that, because you know why. You can change your medication, you can exercise, you can put up your feet to improve it. But I'm talking about swollen leg, which is unexplainable. It has nothing to do with exercise. It has nothing to do with medication. It has nothing to do with whatever you have done, but you're getting swollen leg. It could be a sign of heart disease. It could be a sign of heart failure. It could be a sign of kidney disease. It could be a sign of what we call lymphoedema. So when you're getting swelling of legs and it's been going on and you can't think of why, please consult your medical personnel to find out what is going on. The 10th one I'm going to mention is change in bowel habit. It's okay if you have eaten something that is giving you diarrhea, you know why. Or you're taking some medication that is giving you constipation, you know why. But when you are having constant diarrhea, you can't explain it. Constant constipation, you haven't changed your diet, or even blood in your stool, those are warning signs. Those are the things to look out for and think, hang on, what's going on here? My advice is do not wait too long. Consult your GP, consult your doctor, consult your specialist, because that could be a sign of irritable bowel syndrome. Some people like to go into the pharmacy to buy things for IBS. But my advice is get it diagnosed first, because it might not be IBS. So this could be IBS. This could also be a sign of inflammatory bowel disease. That's a group of disease like Crohn's disease. It could also be a sign of colorectal cancer. So please, if you're having bloatedness or diarrhea, or alternation between constipation or diarrhea or blood in the stool, do not just wave it off. It's always good to be safe than sorry. So go to your GP, find out what is going on, because this could be something more sinister. Thank you for watching, and I hope you picked up something. Please subscribe if you haven't done so, and then check out my channels. I've released so many topics. And I'm also dealing with topics people are sort of sending me personal message about. If there's something you want me to deal with, I will deal with it. But I will also raise another 10 conditions that will raise a red flag. Thank you for watching, and goodbye for now.